But what do you do when your shoulder is so stiff and painful that you just can't take it anymore? And despite all of your best efforts, cortisone shots, physical therapy, and stretching, nothing seems to work. Well, there might be another treatment option that could really make a difference in your pain and lack of shoulder mobility brought on by frozen shoulder. You might have heard of a manipulation under anesthesia, where a patient is under full anesthesia and the shoulder is forcefully moved to break up adhesions and improve range of motion. Manipulation under anesthesia is often considered for extremely stiff and painful shoulders, usually due to a condition like frozen shoulder, especially when other treatments have not worked. So what exactly happens under a standard manipulation? Well, the process starts with you being under full anesthesia, meaning you're completely unconscious and won't feel anything. Once you're out, your orthopedic surgeon will move your shoulder through its full range of motion. And this isn't just a gentle stretch. The aim is to break up the adhesions and scar tissue around the shoulder joint by forcefully moving the shoulder. Yeah, not the most elegant procedure ever performed. And I totally understand if you're hesitant about letting a doctor tug on your shoulder like it's an MMA fight. While manipulation under anesthesia can be effective, it definitely carries risks. There's a chance of damaging the joint or surrounding tissues. Common risks include fracture, tearing of the rotator cuff, or damage to the labrum and ligaments. But thankfully, there's a more gentle approach called translational manipulation under anesthesia. This technique is gaining attention as a potentially safer and more effective alternative to traditional manipulation. Instead of forcefully moving the entire shoulder joint, translational manipulation involves a more precise and gentle movement. The procedure begins with an interscalene brachial plexus block, a type of local anesthesia that numbs the shoulder area. Once the patient is relaxed and pain-free, the manipulation starts. In translational manipulation, a two-person team often performs the procedure. One person stabilizes the shoulder blade, while the other performs controlled, gentle movements to glide the shoulder joint in specific directions. This method targets the tight, stiff tissues that are restricting movement, aiming to improve range of motion without the same level of risk associated with more aggressive manipulations. Many patients report immediate increases in their shoulder's range of motion, and a noticeable decrease in pain right after the procedure. Translational manipulation under anesthesia offers a less aggressive option compared to traditional manipulation, with the potential for significant improvements in the shoulder mobility and pain reduction without the risks. However, it's worth noting that translational manipulation isn't as commonly performed as traditional manipulations, partly due to a lack of widespread training in this technique. Nonetheless, I suggest investigating your area to see if there's any surgeons or physical therapists in the area that does this procedure. And if you found value from this video, don't forget to give it a like. And as always, subscribe to the channel so you can learn more about your body, how it works, and what it needs to keep moving.